Hamish, tell me about what you're building and what problems you're solving.
Yeah, sure. So I work for a company called 32Co. They're a MedTech startup based just down the road here in Hoxton. And essentially the problem we're trying to solve is that there's a big backlog of people on specialist waitlists to see specialists. At the moment we're trying to build a platform that essentially connects general practitioners with these specialists so that they can basically solve the backlog issue that we're experiencing in the NHS. So our platform links one general dentist or one general GP with a specialist, and therefore they can carry out the specialist treatment with the oversight of the specialist, if that makes sense. So essentially we're trying to democratize the access to specialist healthcare.
Okay, and what's your Stripe integration?
Yeah, so actually we're trying to build kind of like a practice level dashboard at the moment. So a practice can, for a dental practice this is, essentially take payments and set up direct debits on behalf of, through Stripe Connect. We can allow the dentist to do that and the practices to do that. And essentially the Stripe integration is, can we create a white labeled version of the Stripe dashboard within our platform so that it's all in one place. They can track, they can plan treatments, they can send the treatment proposals to the patients, and now hopefully they can also set up payments within our platform as well. So,
can you tell me a bit about the decision process as to why you landed on Stripe Connect?
Yeah, so it was actually, we've been speaking to Stripe probably like 18 months, and like 18 months ago, we weren't really in a position to necessarily make a hard and fast decision, speaking to loads of different providers. To be honest with you, our dev team just really like the idea of integrating with Stripe. They have worked with it before and found it really, really useful. But also Stripe Connect just seemed like a model that fit us really well. You know, a lot of dental practices already have Stripe accounts, so we've actually gone with a standard model. But we also have all of the ability to essentially white label the platform as we like, using embedded components and also, putting our brand colors on the onboarding experience and everything. So just worked for us on multiple different levels. Yeah.
Were there any unexpected challenges that you hit when you were building or integrating with Stripe?
Yeah, I think like deciding between standard and express was quite a tough one at the start actually, and had a fair few calls with some of the implementation engineers just trying to understand the differences. But largely it's been okay. I mean, I say that we're rolling out phase 1 at the moment, which is just the ability to set an amount and take a payment. We'll see when we get into these more complex white label dashboards where we have, the ability to set up direct debits and resolve payments and resolve issues. So maybe I don't want to speak too early on that, but so far so good. Yeah.
So we're here at Startup Build Day London. What brought you to the Build Day? What was interesting for you about coming to this day?
Yeah, so I think that, first of all, we're 5 minutes away. But it really coincided well with what we're trying to do at the moment, which is build a more complex, essentially, version of the Stripe dashboard within our platform. And I'm literally starting the product requirements for that this week. And so when I've been speaking to some of the Stripe team here, they said there's a build day that would be really, really useful. We spent an hour and a half today speaking to one of the implementation engineers, walking me through all the different edge cases that I need to think about, some of which I hadn't thought about, so very, very useful. And then also just come to meet other startup founders, other PMs, and made some good connections there just to hear about how they're dealing with it as well. So both of those things.
And so how new is the startup that you're working in?
The startup's actually, you could consider it maybe more of a scale up at this point,
okay.
But they're about 5 or 6 years old. We've got about 50, 60 people now working here. So when we first started speaking to Stripe a few years ago, there's a lot less than that. So it's growing and an exciting place to work at the moment, for sure.
Were there any challenges that the business had that were maybe unexpected and market fit?
Yeah, I think that when we first reached out, there's a big market player in some of the verticals that we work in. So Invisalign in the field of orthodontics, like everyone knows it, and so we've been definitely trying to figure out how we fit into the market. Now the one thing is that we've got connection to specialists in ways that a lot of the other platforms don't. We've got some of the best specialists in the country working for our platform, but trying to transition from just platform that might be positioned towards new dentists and people that are just starting out, now towards the bigger enterprise plans, has been something that's been like an interesting transition. And over the last 6 months, we've been hammering, basically trying to figure out what the pain points are, not just for these new dentists. We've done a really good job of onboarding, but the people that love their old systems and are kind of maybe more traditional in how they make decisions about who they go with. So as the young upstart, that's been somewhat of a challenge, but I think we're on our way to doing it, and now we've got a really compelling platform. So I think that, if we integrate the stuff with Stripe, I think that we've got an offering that's much better than the traditional system. So,
where can people go to use the platform?
Yeah, so if you're a general dentist and you want to provide specialist orthodontic treatment, then the best place, and I don't just say this because I work there, the best place to do that is with our platform, which is called 32Co. And essentially they can sign up there, get linked with one of our specialists, and get providing specialized treatments really quickly.
Hamish, thanks very much.
Yeah, thank you very much.